My name is Bailey Hatter, and I'm going to talk a little bit today about should adolescents be able to get birth control without parental consent? What do you think birth control is? Would you consider it solely a contraceptive, or would you consider it to be used as other healthcare related problems? So, should kids be able to get birth control without the consent of their parents? I feel that adolescents should have the resources to get birth control without their parents' consent. Birth control can be used for a variety of things. For women of all ages. For example, it can prevent teen pregnancy, it can regulate menstrual cycles, and it can help with other health care issues somebody might have. First, let's look into the issues of teen pregnancy and why these children should be able to get birth control. One thing is that children or girls or boys this age don't know enough about sexual education. There aren't classes for this anymore, well, specifically where I go to high school. And a lot of schools don't offer them. A lot of times, the parents don't even allow the child to go. Obviously, as kids get older, they're going to become more comfortable with their own bodies, and sex is one of those things that begin to happen. This would also reduce the need for unsafe abortions. Imagine having to go home to your parents at 15, 16, 17 years old and tell them that you're pregnant. A lot of kids would be scared and might take matters into their own hands. You can terminate the pregnancy sometimes, but if you do and you do not pass the fetus, you then have a fetus in your body that is decaying and you will become septic. Next, we're going to talk about how birth control can regulate menstrual cycles. According to the National Institutes of Health, birth control can help to regulate a cycle with an artificial cycle. This means that you have 3 weeks of a hormone pill that keeps you off of your menstrual cycle, and then you start a week of a placebo pill that then starts you into an artificial cycle. Once starting a new pack, you start back with the hormone pills, which then stops it. The next topic goes hand in hand with the second. Birth control isn't just used as means to stop pregnancy from happening. It can be used for a wide variety of things. One thing that many people use it for is regulating their period. Many women have irregular periods that can last longer than a week. This has caused them to be in very much pain or periods that last a little longer than are supposed to. With healthcare related causes of birth control, it can be used to ease down pain that can be caused by different uterine diseases. One disease that this can help is endometriosis. According to the Mayo Clinic, this is when tissue similar to the tissue that lines the uterus grows on the outside of the uterus where it doesn't belong. It is very painful. Personally, I have been diagnosed with endometriosis. I was 13. Leading up to the diagnosis, I had extreme lower abdominal pain that would lead to vomiting or fainting. I lost drastic amounts of weight due to lots of blood loss. Once being diagnosed, I was put on a birth control to help minimize my symptoms. I had my first procedure in December of 2022, and after the procedure, they put me on another birth control to help with the symptoms after the surgery was complete. In conclusion, I just want you all to get out of this that birth control isn't used for solely preventing pregnancy. I hope I've persuaded you that birth control should be available to adolescents without their parents' consent, and I want you to realize the beneficial aspects of birth control. If you are a parent now or plan on being a parent later in the future, I hope that you take this speech into conclusion. Thank you.